Hi everyone. Today we're diving into an important and deeply impactful topic, the diagnosis and management of breast cancer. We'll explore how breast cancer is diagnosed, the various diagnostic tests involved, and the management strategies to effectively treat this condition. Understanding these aspects can help you make informed decisions about your health and care. Hi, I'm Dr. Knapp, family medicine physician here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Breast cancer is diagnosed through a series of steps and tests. The process often begins with a routine screening mammogram, which is an X-ray of the breast used to look for signs of cancer. If the mammogram detects an abnormality, additional diagnostic tests are needed to determine if it is indeed cancer. When an abnormality is found on a mammogram, the next step usually involves more imaging tests. An ultrasound may be performed to provide a clearer picture of the area of concern. This test uses sound waves to create detailed images of the breast tissue and can help distinguish between the solid mass, which may be cancerous, and a fluid-filled cyst, which is typically benign. In some cases, an MRI scan may be recommended. MRI uses magnetic fields and radio waves to create detailed images of the breast. It's particularly useful for women with dense breast tissue or those who have a high risk of breast cancer. An MRI can help provide additional information about the size and extent of the cancer. If imaging tests suggest the presence of a cancer, a biopsy is the next step. During a biopsy, a small sample of breast tissue is removed and examined under a microscope to check for cancer cells. There are several types of biopsies, including fine needle aspiration, core needle biopsy, and surgical biopsy. The choice of biopsy depends on the location and size of the abnormality. A fine needle aspiration involves using a thin needle to remove a small amount of tissue or fluid from the suspicious area. This procedure is relatively quick and minimally invasive. A core needle biopsy uses a larger needle to remove a cylinder of tissue, providing a larger sample for analysis. In some cases, a surgical biopsy may be necessary, where a surgeon removes part or all of the lump for examination. If a biopsy confirms the presence of cancer, the next step is to determine the type and stage of the cancer. This information is crucial for developing an effective treatment plan. Breast cancer can be classified in several types based on their origin of the cancer cells and their specific characteristics. The most common types are ductal carcinoma in situ, or DCIS, and invasive ductal carcinoma. DCIS is a non-invasive cancer where abnormal cells are found in the lining of the breast duct but haven't spread outside the duct. Invasive ductal carcinoma starts in the ducts and then invades nearby tissues in the breast. Staging the cancer involves determining the size of the tumor, whether it has spread to nearby lymph nodes, and whether it has metastasized to other parts of the body. Staging is done through a combination of physical exams, imaging tests, and sometimes additional biopsies. The stages range from 0 to 4, with stage 0 indicating non-invasive cancer and stage 4 indicating advanced cancer that has spread to distant organs. I just want to take a moment to ask that you like this video if you find it helpful, subscribe to my channel for more health content, and leave a comment down below if you have any questions or topics you want covered in future videos. Anyway, management of breast cancer involves a multidisciplinary approach, often including surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and immunotherapy. The choice of treatment depends on the type and stage of the cancer, as well as the patient's overall health and personal preferences. Surgery is a common treatment for breast cancer and may involve lumpectomy or mastectomy. A lumpectomy, also known as breast-conserving surgery, involves removing the tumor and a small margin of surrounding tissue. A mastectomy involves removing the entire breast and may be necessary if the tumor is large or if there are multiple areas of cancer in the breast. In some cases, a bilateral mastectomy, where both breasts are removed, may be recommended, especially for women at high risk of developing breast cancer in the other breast. Radiation therapy uses high-energy rays to target and kill cancer cells. It is often used after surgery to eliminate any remaining cancer cells in the breast or nearby lymph nodes. Radiation therapy can reduce the risk of cancer recurrence and is usually administered over several weeks. Chemotherapy involves using drugs to destroy cancer cells throughout the body. It is often recommended for cancers that have spread beyond the breast or for aggressive types of cancer. Chemotherapy can be given before surgery, known as neoadjuvant therapy, to shrink the tumor, or after surgery, known as adjuvant therapy, to eliminate any remaining cancer cells. Hormone therapy is used for hormone receptor positive breast cancers, which rely on hormones like estrogen or progesterone to grow. This therapy works by blocking the body's natural hormones from reaching the cancer cells. Drugs such as tamoxifen and aromatase inhibitors are commonly used in hormone therapy. Targeted therapy involves drugs that specifically target certain molecules involved in the growth and spread of cancer cells. One example is trastuzumab, also known as Herceptin, which targets HER2-positive breast cancer cells. Targeted therapies often have fewer side effects than traditional chemotherapy because they are designed to specifically attack cancer cells. Immunotherapy is a newer treatment that helps the body's immune system recognize and attack cancer cells. It is being studied and used for certain types of breast cancer, particularly triple-negative breast cancer, which does not respond to hormone therapy or targeted therapy. Managing side effects is an important aspect of breast cancer treatment. Common side effects of treatment can include fatigue, nausea, hair loss, and changes in appetite. Supportive care, including medications to manage side effects, nutritional support, and counseling, can help improve quality of life during treatment. Follow-up care is crucial after breast cancer treatment to monitor for any signs of recurrence and to manage any long-term side effects of treatment. Regular follow-up appointments with your healthcare team, including physical exams, mammograms, and other tests, are essential to ensure any recurrence is detected early and managed promptly. Living a healthy lifestyle can also support your recovery and overall well-being. Eating a balanced diet, staying physically active, and maintaining a healthy weight can help reduce the risk of recurrence and improve your overall health. Emotional support, whether through counseling, support groups, or loved ones, is also vital during and after treatment. Thank you for watching. As always, take care of yourself and make the most of your day.